card he plays with this kind of a surplus allocation kind of thing. Okay, so let me move on to talking about some of the dynamics of the recent economy as a way to sort of understand where we are with our state budget and some of the state budget pressures. And I apologize, the remote isn't working for advancing these slides, so particularly to you, I'm going to be going back and forth to advance the slides. But I want to make 3 points, which is that the recession has had a great impact on Virginia's economy and on our state budget, and we are still dealing with it. Secondly is that the recession also revealed key structural problems with our state's revenue system that I think are extremely important to understand. And then finally, key fiscal issues that Virginia is facing in the coming months are going to have a very important consequence for Virginians, especially low and moderate income Virginians. So first of all, like the rest of the country, Virginia was battered by the recession. Unemployment soared in Virginia in recent years. At its peak, it increased 121% from the start of the recession. So in December of 2007, our unemployment rate was 3.3%, and it soared to 7.3% at its peak in January of 2010. So we had a 121% increase in unemployment in the state. Foreclosures soared, housing prices tumbled. I don't need to tell you guys any of that because you were in the depths of it. And so as a result, state revenues dropped substantially. That's because when people have jobs, they're earning an income and they're paying taxes. They're paying income taxes and they're buying stuff and they're paying state sales taxes and excise taxes. And when they lose their job, that fundamental underpinning of our entire state revenue system declines significantly. When you're not working, you're not paying as much in income taxes. You're not buying as much stuff, and so you're not paying as much in sales taxes. You're not driving to work, and so you're not buying gas and paying as much in excise taxes. And therefore, this puts a very significant downward pressure on state revenues, and they tank. At the same time, corporate income taxes also plummet. The more appropriate term for Virginia's corporate income tax would be a corporate profits tax, because our 6% corporate tax is only levied on corporate profits. So revenues minus cost is profits. And that profit number is what gets the 6% corporate tax gets levied against. So if you're a business and you're losing money, if you're a business and you're laying people off because you're not selling as much things to your customers, you're not earning a profit, and therefore you're not subject to the state's corporate tax. And therefore, corporate income tax revenue also declines dramatically. It's quite volatile because it's based only on profits, and so that also declined very dramatically. And in fact, these forces combined in a way to create a historic situation for our state. We had state revenue declines 2 years in a row in Virginia, and that is not something we had ever seen before since we were keeping records on this thing. Not only was the length of the decline longer, but the depth of the decline was bigger than what we had before. So our decline in revenue of 9.6% in 2009 dwarfed the less than 4% decline we saw in the prior recession in 2001. So huge decline in the resources the state was bringing in and had available to allocate for programs. At the same time, though, the very same time that that's happening, demand for public services was skyrocketing. Food stamps were up 43%. Enrollment in TANF was up 25%. In Medicaid, up 11%. Those enrolled in our state's community colleges and universities rose 8% as unemployed workers returned to work to get some job training or complete a degree or something like that. So Virginia then had these enormous budget shortfalls like almost every other state during the recession. And so the question is, how did we deal with those shortfalls? We dealt with them with a mix of strategies, heavy on the cuts, and about a third of the budget shortfalls that we faced during the recession were closed with, over a third of the shortfalls we faced during the recession were closed with cuts to programs. We used our state's rainy day fund. Arguably, we were well prepared going into the recession because our state's rainy day fund had the biggest balance on record, $1.2 billion. You build that fund up during the good days and you draw it down during the bad, and we did that. We used Federal Recovery Act money. That funding helped close about 25% of our state's shortfall. And then we also used other one-time tactics to reach balance. Things like shifting funds out of special funds into the state's general fund. Delaying some capital projects, floating bonds for others, things that we would normally pay cash for, we floated bonds for. And knowingly underfunding our state's pension system. I mean, we skipped one of the normally required payments into our state's retirement system that generated $850 million a year in budget savings in one biennial budget. But we still have, so let me look at, sorry, I lost the thing again. Let me just show you really quick what all that looks like when you rack up the different strategies that we use. So what this chart reflects is all of the shortfalls that we had during the recession. And you can see these different slices of the pie. 38% cut by spending cuts, the red section, 7% by the rainy day fund, 27% in blue by Federal Recovery Act, 7% by VRS borrowing, 15% by transfers, and we had some modest tax policy changes where we did some shifts around, some changes to our tax policy that brought in some additional revenue. But the problem is we still have a problem in our state, because things continued to worsen well beyond the official end of the recession, which was June of 2009. The number of unemployed people in our state continued to rise into 2010. TANF caseloads didn't peak until 2010 either. In fact, other services are continuing to increase. SNAP and Medicaid enrollments are still peaking. We are at the highest point now for enrollment in food stamps, now known as SNAP, and in our state's Medicaid program. That's fully 3.5 years after the official end of the recession. And so when we look at how those kinds of pressures for the demand for public services, let me see if this is going to do this, needs remain still quite high. So unemployment is still 115% above where it was before the recession. SNAP enrollment is 77% above where it was before the recession. Medicaid is 28%, and TANF is still up 4%.
Michael,
So we are not out of the woods yet.
Michael,
Yes?
on those three programs, could you briefly say what is some of that in the state, some of that's paid by state and some by feds or how?
Yes. So, okay, so starting at the left, TANF is, is welfare, and that is, federally funded through a block grant to Virginia, but the, locally administered and state oversaw in terms of eligibility and enrollment and things like that. Medicaid is joint federal state funded and state administered. So we provide state general fund dollars that are matched by the federal government, and again, locally administered, enrolled for basic Medicaid, and we have a centralized enrollment piece for our children's health insurance program, FAMOUS. SNAP, again, federally funded, state administered. So what this speaks to is really just giving you the numbers on how there's continues to be a high level of demand for public services. So in the great irony of life, if a business had more customers at their door, they would expand. But because we have to balance our budget, and because revenues tank, states actually cut back during the very time when the demand for their services grows. So as you can see, it's sort of this disconnect in terms of how to meet the growing needs of a community and what resources you have for those. And so the point I'm trying to make is for us to remember that this far out from the official end of the recession, we are not out of the woods yet, and we still have high demand for public services, which is, I think, a critical way to sort of understand the big picture issues that we're facing in our state budget. So what I'm trying to do in this segment of the talk is really walk you through what are these key pressures that are facing the state budget. What is the stuff behind the scenes when lawmakers say to you, we still have a tight budget? What are they talking about? This is what they're talking about. Continued high demand of public services. Now the other problem, though, is a lot of those tools I mentioned that we use to manage our way through the recession, they are gone. The Federal Recovery Act money is over. The state's rainy day fund is mostly depleted. We monkeyed with our debt capacity model to give us even more headroom to borrow money during the recession, and we are bumping up against even that higher amount that we were allowed to borrow because we have a cap of 5% debt service of tax revenues, and we are bumping up against that. On top of that, new revenues that we do get in above baseline, so above this forecasted revenues, this whole picture around how well did we think the economy was going to perform, builds the baseline for the budget, and to the extent that we get some new revenues in above that, there are already claims on that money. I'm not talking about claims on money like we did with the surplus, which is sort of an after the fact, there's some money left over, how are we going to allocate it? I'm talking about claims on the front end. So when we think about the fact that revenues might be increasing because the economy is slowly getting better, we can't think of it as like we're out of the recession, and so we just put the pedal to the metal and we surge down the highway, we're turning good times coming back. No. That metaphor is really not apt. It's more like our car's transmission is stripped, we've got some rust around, the bumper's kind of hanging off, and the rearview mirror has been stripped off. So, your ability to just merge on to the superhighway of state revenue is hamstrung by the stuff we did to manage our way through the recession. And the fact that, as I mentioned before, at the center of our state's revenue system is jobs. People having jobs, earning income, paying taxes, not needing public services because they have health insurance through their job. They're making money to put food on the table. But look at that right bar. Unemployment is still 115% above what it was in Virginia at the start of the recession. So we still have a fundamental challenge when it comes to jobs, and that makes a fundamental challenge in terms of state revenues. But we have been able to eke out some increases in state revenues. But a lot of things have a claim on those dollars off the top. So in our case, what does our strip transmission, bumper falling off the back look like? Well, we've got to repay the retirement system. We borrowed $850 million from the retirement system, and that has to be repaid. So that's going to be off the top. The governor says he wants to do it faster than what the actuaries tell us we need to over the next 10 years. So there's a serious claim on that kind of money. Secondly, believe it or not, we actually are in a position where even though we're not out of the woods yet in terms of our budget pressure, we're starting to have to replenish the state's rainy day fund. Because it doesn't take much revenue growth to trigger an automatic required payment into the state's rainy day fund. And that's already begun in Virginia. Our unemployment insurance trust fund is insolvent, and we borrowed money from the feds to continue to make payments to unemployed claimants in our state. The interest on those borrowings is owed to Washington, and we pay that out of our state's general fund. So that's another claim on dollars coming in. And then unwinding some of the gimmicks we used to manage our way through the recession costs money. I'll give you an example. One of the things we did to book some extra budget money was to require retailers to remit their sales tax revenue that they collect early to the state. Typically, they remit the money that they collected in June in July. We had them remit July's a little bit early. That's convenient because June 30th is a different fiscal year. So we shoved 13 months of retail sales tax revenue into a 12-month budget. And that was hugely helpful in getting that 12-month budget to balance. Because when you and I go to Best Buy and buy something, the retailer collects the sales tax on behalf of the state. And then they send it to the state every month. We have been slowly unwinding that gimmick, but we still have about $120 million where retailers, big retailers, are still remitting early. So when we go to unwind that gimmick, it's going to be 11 months of revenue in a 12-month year. And so that's still on the books. And so at the center of all of this, as I mentioned, is jobs. And let's look at where we are with jobs in Virginia. I'm sorry, one of the key things is revenues. And let's look at where we are with revenues once we try to adjust what they look like for a growing population and inflation. So our revenues to meet these needs and to try to solve some of these problems remains well below recession. So the baseline here is 2007, so prior to recession. And you can see how dramatically revenues tanked during the recession. But we're a growing state, and a dollar today doesn't go as far as a dollar did in 2007. And when you account for the increase in our state's population and inflation, our revenue is still below 2007, even in this enacted budget we just enacted, 2013 and 2014. And that continues to be a key challenge for us in terms of having the resources available to meet needs. And one of the key reasons for that is because, keep screwing that up. I'm going to just go back to the computer. Is our state's jobs gap. So this shows us how much of a hole we are still in with regard to employment in Virginia and the number of jobs. The red zone is the number of jobs that we lost during the recession that we still haven't gained back. So we still have to create 321,000 jobs in the state to get back to pre-recession levels. And one piece of that is we need to create 55,000 jobs to get back to pre-recession employment levels just in terms of the jobs that we lost since December of 2007. But on top of that, even during the recession, our state has been growing, and our state's workforce has been growing. And so to have enough jobs to actually account not only for the jobs lost, but also for the increasing size of our state's workforce, we would need to create another 265,000 jobs to return to pre-recession employment levels. That is the share of the workforce that's working. So what we see from this chart is we lost a bunch of jobs. So here's the recession, and then we entered the recession a little bit later than the rest of the country. You see this line started to go down beyond December 2007, which is like here. But we certainly did tank, right? And then you see this really low point in January of 2010. And we've been making up some ground ever since, but we're still not back to where we were in terms of the total number of jobs. And we have this a larger workforce. But in addition, all of these problems that we experienced during the recession, not only were a lot of our budget problems recession-driven, a decrease in resources and an increase in demand for services, but the recession also revealed a lot of the key structural problems with our state's revenue system. So we haven't just faced budget shortfalls during the recession, we have faced budget shortfalls in 10 of the last 12 years. The only years we did not have a budget shortfall was 2007 and 2008. Now, by that, I want to go back to something I said earlier. Every year, the Virginia governor introduced a balanced budget, the General Assembly produced a balanced budget. But at the beginning of the budget building process, when they're looking at getting all the agency requests and when you're looking at what demand for services, you can see a shortfall between how much revenue we have versus how much the cost would be to deliver tomorrow what we're delivering today. And we have had those kinds of disconnects in 10 of the last 12 years. Every year in November, the General Assembly's money committees have a retreat where they get together and they talk about the issues facing Virginia and facing the General Assembly. And their estimates of these budget shortfalls in those presentations saying, this is the situation. We're going to have to either raise taxes to bring in more revenue or make cuts to bring this thing in balance because we right now have a shortfall. And that's been the case in 10 of the last 12 years in Virginia. And if you forecast out future revenues and future expenditures, you see shortfalls as far as the eye can see. when you look at the state's own 6-year financial plan and you see what's happening with the growth in the need for public services and the revenues to get there, we all have shortfalls through 2018. One of the key causes for that is our state's revenue system is upside down. We have low-income people pay a higher share of their income in taxes than do upper-income people. So the poorest segment of our population, those making less than $19,000 a year, they pay about 9% of their income in state and local taxes. Income, sales, excise, property taxes.
What was that percent?
9% for the lowest, we call them quintiles of income groups, the lowest folks making less than $19,000. For folks making over $500,000 a year, they pay just 5% of their income in taxes. Now this just doesn't make any sense. I mean, I work in the world of quintiles and percentages and stuff like that, but let me take a moment to try to explain what I mean by how this is upside down. So these quintiles is basically groups and groupings of 5, and taking every taxpayer in the state from the lowest earning person to the highest earning and grouping them into chunks of 5. And you analyze kind of what's happening to those income groups, and that's a very standard way of trying to understand what's happening to the economy, what's happening. Let's not think of them as 5 income groups, let's think of them as 5 people. So let's think of a woman who she and her husband raised their 5 kids, and her husband died, and she's getting elderly, and they're going to have to put mom in a nursing home. And so the 5 kids are getting together to talk about how are they going to take care of mom's needs, how are they going to fund mom's needs for nursing home care. And those 5 children have had very different paths in life. One of them works part-time as a cab driver. Another one is a waitress in a restaurant. Another one is a secretary at a business. One son made it big, and he's a partner in a corporate law firm. And another daughter made it really big, and she's a hedge fund manager on Wall Street. So all 5 kids have very different income profiles. They make totally different amounts of money all across an array of income. So when that family is getting together to talk about how are we going to provide for mom's care, one way to do it would be say, well, why don't we have the hedge fund manager pay a little bit more, a little bit of a bigger share of her income to pay for mom's care. Or somebody else might say, let's have everybody pay the same amount. We'll all pay the same amount. But then somebody says, oh, I know what we'll do. We'll have the part-time cab driver pay more of his income to care for mom's care than the hedge fund manager. That's what we'll do. That's a good idea. We'll have him pay actually close to double what the hedge fund manager pays in terms of a share of income. That's the best way for us to fund mom's care. What would you think about that kind of conversation? Right? You'd probably say, that is a completely dysfunctional family. That is a ridiculous way to figure out how to fund mom's care. Here she spent her life raising them, and a few extra dollars from the hedge fund manager is going to go a lot farther than taking a greater share out of the part-time cab driver. But more or less, that's what we do in our state's revenue system. Folks making the least pay the most. One of the reasons why that is because we have essentially a flat income tax system in our state. We have a slightly graduated rate structure. We have a few different rates. They top off at 5.75%. The problem is that highest rate kicks in at only $17,000 of income. As a result, over 60% of taxpayers in our state pay that highest rate. So even though on paper we have a slightly graduated income tax structure, in practice the vast majority of taxpayers pay that highest rate, and so it's basically flat. In the meantime, income has been soaring at the top. Almost all the income growth in Virginia that we've enjoyed over the last 25 years has been concentrated among high-income individuals. But we've done nothing to adjust for that reality. The last time we adjusted rates in our state was in 1987. Prior to that, we actually used to adjust rates on average about every 3 to 4 years. But since 87, we haven't adjusted our rates. So our income tax system is not able to capture where the growth is in our economy, which is among high-income earners. The corporate tax rate is similarly frozen in time. Its 6% was enacted in 1972. I was 1 year old. We've also opened up a huge array of costly tax breaks and special deductions and preferential exemptions for people in the tax code. These are called tax expenditures. So one of the things we need to understand in terms of how our state makes its decisions around the state budget isn't just around where are we going to fund and how much are we going to provide to the services, but how much are we bringing in? And when we look at the revenue system, we have carved hole after hole after hole into that system so that we actually now, according to a recent evaluation by JLARC, give away about as much money as we take in our state's revenue system. So this is, a special exemption if you are over 65, not, very limited income basis for that. We have a little bit of a means test on that, but it has a giant loophole in it. A special tax break if you're a business and you do certain things, and the way you can therefore report your earnings it can be much more preferential to you. We have tax breaks for folks who buy long-term care insurance. We have tax breaks for these special back-to-school holidays and hurricane season holidays and all of that. And all of these build up over time. And they're kind of on autopilot. They sort of sit in the tax code. They're not like the budget that gets reviewed every year. They're just kind of on autopilot, and they cost more and more money each year. As a result, to a large extent, a large number of corporations have no income tax liability in Virginia. 60% of the corporations in this state had no state tax income liability, according to the most recent data by the tax department. On our sales tax, for example, we tax goods and not services, but yet our economy has been growing and changing from making stuff to services. And so as a result, we tax a smaller and smaller share of economic activity that's going on in our state because we tax very, very few services. Sales tax as a share of our state general fund, for example, has been falling ever since 1977 because of these shifting consumption patterns on behalf of by Americans. E-commerce, for example, has emerged, and that's basically an untaxed space for state sales tax. The Federation of Tax Administrators identified all the things that states tax in the realm of services, and they identified 168 of them. These are stuff that states tax. Virginia taxes just 18 of those 168 services. This has equity impacts too, because if you go to a grocery store and buy the stuff to color your hair, you pay the sales tax. If you go to a beauty salon and have someone color it for you, you don't pay the sales tax. If you go buy a lawnmower to cut your own grass, you pay the sales tax. If you have a lawn service cut your grass, you don't pay the sales tax. So you can see there's also these equity dimensions in terms of the stuff that higher income folks buy and do aren't subjected to it. I mean, a huge segment of low income people don't even have regular access to the internet. So they're not buying that much in terms of items and clothing and things off of the internet in the way that upper income folks who have consistent access to the internet do. So what's facing us in terms of these challenges? We have these huge effects of the recession that continue to linger because we continue to have a huge job gap in our state. We have been a lot of structural problems with our state revenue system. The key things I think that we are facing are really threefold. One is this key question around whether Virginia is going to expand our state's Medicaid program. This is the public insurance program for low-income people. One of the results of our state's of the Supreme Court decision on the Affordable Care Act was a change with regard to the expansion of coverage through the Medicaid program. But would it be helpful to give like a background of what we're talking about here with Medicaid? Is this sort of 2 seconds? Okay. Basically, the Affordable Care Act had 3 big buckets of stuff it did. 1, a significant expansion of health insurance coverage for Americans. that was done through two primary vehicles. One is an expansion of state Medicaid programs up to about 138% of the federal poverty limit. The second one is the creation of these state health benefit exchanges, marketplaces where people will be able to go and buy private insurance, not public insurance, private insurance. But on a sliding scale, subsidies will be available for folks to make their purchase of those insurance more affordable. Secondly, there was a whole boatload of private health insurance market reforms. Things like you can't, throw people off the rolls once they get sick, eliminating pre-existing conditions, allowing kids up to 26 to stay on their parents' health insurance. And then there was a set of Medicare payment rate policy reforms and other payment innovations that was also included in the Affordable Care Act. What I'm talking about here is that first piece, this significant expansion of coverage that was in the Affordable Care Act. The Supreme Court said everything in the Affordable Care Act stands except for the federal government cannot require states to expand their Medicaid program. It has to be an option for states. The way the original Affordable Care Act was written, there was this big juicy carrot that the feds were offering, which was, we'll pay for 100% of the cost of your expanded Medicaid program. In a state like Virginia, they typically pay 50% of the cost. So that was a good deal for states. But that juicy carrot came with a big stick. And that said, if you don't expand your Medicaid program, we can come back, we can actually rescind federal dollars for your existing Medicaid program. And the Supreme Court said, that's going too far. You can't do that. States have to have the option of doing this. So we have now a very significant policy debate on our hands in Virginia. Are we going to opt to go ahead and expand Medicaid? Our governor has not said he's not going to do it like governors in Florida and Louisiana and Texas have. He's waiting until after the presidential election on November 6th. But this is going to be a key issue in the General Assembly. Are we going to go ahead and expand Medicaid? Are we going to go ahead and create our own state health benefit exchange? It's probably too late for us to get approved to have a state-run health benefit exchange. The federal government will likely have to administer one for us through a partnership agreement until we get our act together, because we've missed a lot of key deadlines from HHS for that. But that is a very key issue that we have that I think is going to be tops in terms of the agenda going forward. And really a key thing that I think folks in the housing community should think about what role they can play in advocating for Virginia doing the right thing and expanding the Medicaid program to include more people. We have a very limited Medicaid program right now in Virginia. We are 48th in the country in per capita Medicaid expenditures. If you're a working parent and you make more than $7,000 a year, you cannot get on our Medicaid roll. That's because we cap enrollment at eligibility levels at only 30% of the federal poverty limit. So for a working parent, for us to go from 30% of the federal poverty limit to get Medicaid to 138 would be a huge step forward. Over 400,000 people in our state could potentially get health care coverage if we go ahead and expand Medicaid. It is, I would argue, among the most important issues we are going to face in our lifetimes in this state. Full stop. And it's a structural issue. There are a lot of one-year budget fights that people are going to have to deal with in the General Assembly around budget amendments and getting one-year funding restored or changed or whatever. This, however, is a very important structural change that says people in our state can get health insurance regardless of where you work, regardless of how much you make. You can either get it through this public program through Medicaid or you can get it through the exchange. If we don't expand coverage, we will have a very significant coverage gap. That's because the health benefit exchange that I mentioned, this new marketplace, those subsidies are only available to folks from 100% to 400% of poverty. So if we stay where we're at, like let's say for working parents at 30%, you would have this gap because then your next available option for health insurance doesn't kick in unless you make a lot more money, like 100%, which would be a very strange public benefit structure to have. Usually, the more money you make, the less benefits you get, or you get them cut off. We would have a situation where super low-income people would have access to Medicaid. Pick up a few hours of overtime, you're off. Then higher income folks would have access to health insurance on the private market with these sliding scale subsidies. They lose a few hours of work, they're out because they drop below 100% of the federal poverty limit. So you can sort of see the dynamics it would create of a significant disconnect between the public insurance and the private insurance options. Secondly, administering and funding the recent Department of Justice settlement with Virginia around mental health services and the care of that is going to be a very key budget driver, where the state has come to an agreement with the federal government around what we're going to do with regard to making the necessary progress and changes to how we deliver mental health services, and that is going to be a significant claim on resources for the budget. And so especially to the extent that housing services connect to that kind of a change, or to the extent that that kind of thing is going to be yet another budget pressure that lawmakers are going to be dealing with, I think it's important to understand it as such. And then, in addition, transportation, transportation, transportation. We have 3 governors now have consumed large parts of their governorships by discussing getting more revenues for transportation in our state, and year in and year out we fail to do that in Virginia. And this year is going to be no exception. We are going to have a big debate over what to do about getting more money for transportation. That is going to suck up a lot of air in the General Assembly. And so I think it's also important to remind ourselves in the human services area and the housing area that that's going to be going on. And so how do you tee up your issues when there's a lot of debate and discussion going on around things like Medicaid, things like the DOJ settlement, things like transportation. And then the impacts of federal sequestration and federal budget deficit reduction things will be obviously hugely important. We are very dependent on federal government spending in Virginia. On per capita basis, the federal government spends twice as much, basically, as they do in any other state, as they do in the national average in Virginia, twice as much. 1 in 10 folks in our state work for the government in some way, shape, or form, and in the rest of the country, that's like 1 in 25. So we are highly, highly dependent on that. So around what those decisions are, what kind of a timeline, what kind of a structure those federal deficit reduction changes, targets, sequestration approaches, those kind of things, will have very significant impact on Virginia. And I think, in particular, around sort of one of the key points that Bob mentioned from the outset, would be sort of part of the explanation and justification you're going to be hearing from lawmakers about why they can or can't do certain things. Is we don't know where the feds are going to be. We don't know how this is going to play out. That's going to have important consequences on our, on our resources, on our economy. And so understanding how those things are playing out in the debate will be, I think, very important in the coming session, so that you have an answer for that, so that you understand what are the pressure points, what's the timing that they're talking about, to be able to articulate a rebuttal to that and explain how it does or doesn't impact what you're trying to articulate, advocate for. So I think in conclusion, you can see that we have a lot of significant budget challenges facing us, but I think there's also terrific opportunities to engage on these key issues, especially when you're armed with information on what are some of these structural issues, what are some of the big picture issues, and what are some of the calendar and timing issues that can hopefully play a role in making sure that you can bring your very best game into the General Assembly session and into public policy, education, and advocacy in general around how Virginia meets the growing needs of our growing state. So do we have time for a few more questions, Bob? Or are we?
Sure.
Just a couple minutes
have
and
a
then
couple of questions and then maybe we'll close out.
that'd be great.
Great. Does anybody have any questions on
It's all
last
out,
part?
right? Like,
Yeah, it's
you
all
got everything.
yeah.
In sort of talking about the various agencies and different demands on the budget, one thing that I didn't hear mentioned was criminal justice services and law enforcement.
Mm-hmm.
And I know it's been several years since I did any sort of direct state level advocacy, but one of the things that I noticed when I did that was that the General Assembly, when considering a policy change, asked for the correctional impact.
Yes.
But that typically was just literally the budget, the impact on the budget of the criminal justice services or prisons, law enforcement,
Yes.
but not any of the associated extra social costs.
Yes.
So for example, if a rapist is locked up
Right.
for longer,
Yes.
what are the savings because fewer people were raped?
Yeah.
You know what I mean? So I'm wondering, like, if at the state level, anyone is bringing in some of those things, so it's almost like you're maximizing the money that you're spending now because you're getting
Yes.
these longer term savings, or how
So-
it impacts other agencies and their services that are required.
So like on this Medicaid thing, for example, we're working on a paper right now at my shop on that, because one of the things that you're hearing in the Medicaid debate is the cost of everything and the value of nothing. So I have a lot of lawmakers saying it's going to cost the state $2.2 billion over 10 years if the federal government, if we do this Medicaid expansion. And that's because of the fact that the feds in the early years pay 100% of the cost, and eventually it comes down to 90%. That's still a really good deal. I mean, our typical program is 50-50, so 90-10 is pretty good. But in addition, when folks come forward to get coverage, if they actually turned out were eligible for our existing program all along, this welcome mat effect that will be going on will mean that when you enroll that person, you actually only get the 50-50 match for them because they were a kid who was eligible for Famous all along but wasn't enrolled. And that's where a lot of the costs are being booked for that. So what we're trying to do in this paper is identify areas where, by expanding Medicaid and getting people coverage through that mechanism, will actually bring pressure off of the state budget, because certain things that we currently pay for with state dollars will now be paid for basically by the federal government through Medicaid. So like in the area of mental health services, there's an array of things that we pay for through our own state general fund dollars that if people had Medicaid coverage, we wouldn't have to do that. And that could be and then there's other public health kind of programs. People have insurance. They don't need free immunizations. They're getting them from their doctor as part of their normal primary care. In addition, I think one of the other things to understand with the Medicaid expansion is we're not in a world before the Supreme Court where it was a decision of are we going to have the Affordable Care Act or aren't we? Are we going to have the individual mandate or aren't we? All of that is in place. Virginia is going to have people seeking coverage because there will be an individual mandate, there will be a state health benefit exchange. So it's not like we're going to be able to avoid people coming forward and getting enrolled that we, are as part of this welcome effect. So objecting to the expansion of Medicaid on the grounds that it's going to bring additional costs to the state, by not doing the Medicaid expansion, we're not going to be able to avoid those costs. People are going to hear that they have to get coverage, and they're going to hear that there's coverage available, and they're going to come forward. And then we'll realize when we screen them for their eligibility, oh, you were eligible all along. And so what we're trying to do is trying to speak to that sort of an issue around sort of acknowledging the other benefits that come from it, just from a state budget standpoint. And then there's all the societal benefits that we know what the research tells us about how important having access to health insurance can play in terms of the quality of life and how much less lost work time you have because you're not sick, and how fewer bankruptcies you have and foreclosures you have because you're able to pay your medical bills and not have to skip paying your utility bill in order to pay your medical bill and stuff like that. And so all of that, I think, needs to be brought to bear on this kind of issue.
One thing is specific education, because so much money goes towards education, but if kids aren't covered or they're not getting the appropriate mental health services, then they're not able to actually learn.
Yes, exactly, and those kind of things. And so part of, I think, the challenge for us is to make sure that those kinds of issues, those kinds of frames are part of the debate and not just the cost of everything and the value of nothing.
Can I piggyback on that for just a minute? Because I think what you just said at the end is so valuable, because I won't speak for everyone, but I'm just going to make the assumption that you represent the highest level of knowledge in this room about budget, fiscal structure, how revenues are generated, what the implications are about where and how budgets are decided. And for our audience, for many of us, we don't have that expertise, but we do know on the ground what the implications are for the people we serve, for residents, or what the implications are of the value of where and how we invest. And I think that that's what's great about being able to work in coalition, because the on-the-ground experience that comes from everybody, no matter what your expertise is, it could be housing, or it could be food, or it could be criminal justice, or whatever it is, really helps tell a story. And legislators need to hear both. They need to know the same kinds of analysis that Jay Lark is going to be doing, explaining, well, here are the fiscal implications and how you horse trade. But they also need to know, okay, for my constituencies, or the way that this will be described by the media, or the way that when I'm going to run for re-election, I can talk about how my decisions affected communities. JLARC doesn't matter, but those kinds of stories do. And I think that by working in coalition at the state level, where we're having our housing professionals who really understand the implications, folks who don't have access to housing, or those who know healthcare or other wraparound services, all the different things that may be talked about, what we can find are these common themes that help us carry both the data and then also the real human impact. And the media loves human impact, and legislators like having opinions that aren't just you should do it because it's the right thing, but also here's the supporting material. So I love hearing you say that, and I just wanted to jump in because that's actually, I think, what the Virginia Housing Coalition, Nonprofit Virginia are trying to do. We are two big statewide groups that are trying to expand our footprint by bringing more voices in the table to say, well, what are some areas that are really resonant no matter where you work, no matter what you work on, but that the implications of how we make choices at the state level could have huge impacts for our ability to deliver mission. And so I just wanted to piggyback on that, because I think what you're saying is so important, and that's not the Commonwealth Institute's bread and butter. Your bread and butter is really with this data and analysis, and they do amazing reports that are available on their website for free. What I think is great for Virginia Housing Coalition, Nonprofit Virginia, is we have them as partners to bring information, and then to say, okay guys, well what do we want to do about it? This is all great, but we're not all trying to become mini Commonwealth Institutes. We're trying to take this information and say, well, how can we use that as a tool to get ourselves in better position, both as a state? Because I'm a resident of Virginia, I care about what our tax and revenue structure is as a person, but then I also care about it in terms of what we invest in.
And that's human story and how it impacts the communities is so important for them to understand and see the connectedness between, if people have coverage, so they're not spending all their money on a medical emergency or paying off an ER visit, they can pay their rent, they can meet their mortgage, they can save money for that down payment, they can pay their utility bills, and so those kinds of things are often not the connections that lawmakers hear. They would typically see a set of healthcare advocates coming into their offices, and so trying to find some of these issues of possible commonality where we see that the same people we all serve have a real stake in some of these key issues to say, okay, do we want to play our limited cards that we have for this issue because we see that the very outsized impacts it could have to the good for our community. That's a heavy lift for a lot of organizations to go outside your wheelhouse, but seeing those kind of connectednesses and figuring out some pathways to do it either through a structure like Nonprofit Virginia or what have you are, I think, some of the things to talk about, as your coalition.
Absolutely.
Right.
Thank you so much.
Thank you very much.
I feel really a lot smarter, but also vaguely more depressed. That's
right. Do you want blissful ignorance or do you want exactly?
But we ended on exactly the right point there, which is that we're just, I think maybe as I'm a houser, or people who are engaged in housing sometimes have tunnel vision about their issue, but we really need to get out of that box. People, a family's ability to access health care has a direct impact on their housing conditions. We see that all the time. My friend Cassidy from Earthcraft is here. The ability of people to afford energy costs has a direct impact on their housing status. So all of these issues really connect up with housing and connect up with the issues that in criminal justice, someone coming out of the criminal justice system, their housing opportunities are really, really poor. And so we need to begin to think about all of these issues in combination. The Housing Coalition will have a legislative agenda this year. Ali Farouk, who most of you know, is drafting that agenda right now, and we'll be pushing that out to you. We have your email addresses now, so you'll be seeing that in the next few weeks. In your packet of materials, if you're not a member of the Housing Coalition, I would urge you to either become an individual member or have your organization become a member. With that, I'll turn it over to Melissa to say a few closing words.
And thank you very much, Bob. And so just to be clear, so the Virginia Housing Coalition, which I'm a proud member, will continue to prioritize, as it should, the things that we know best, which is housing. And everyone in our community, the state, needs to know about housing, even with all the other things that Michael talked about. And so that's a really important role. What Nonprofit Virginia does is it says, let's talk to all of the different sectors that are within this general area of working with those at low income or those who are vulnerable and in need, to learn, well, what are all the priorities that are coming out and where are there areas of commonality where we could have legislators hearing core themes from lots of different places. Michael talked a little bit about how important it is to speak directly with legislators who serve on very specific committees. But if that committee leader is in a part of the state where you don't have operations, it may be really hard to get their attention. By working in coalition, we can help to fill in gaps and say, hey, we're all working together. And we happen to know somebody in Portsmouth, or we happen to know somebody in Danville, or we happen to know somebody in Arlington, or wherever it might be. and then we can work together with common themes. Nonprofit Virginia's job is to help to provide the additional support and capacity so that you do not have to become the Commonwealth Institute, and you do not have to live all of your days in Richmond trying to figure out when are the best times to advocate, what are the best messages that are common, and what are the best ways to take advantage of your time and ability to give the greatest impact. That's our job, is to help support that, help groups like Virginia Housing Coalition and you individually as organizations. I just want to say that in this year, Nonprofit Virginia has done a couple of things, and information about it is in your handouts. In July, we wrote a letter to the governor and to the chairs of all the committees explaining why Medicaid expansion is so important. And it's important no matter what your core mission is as an organization. This is about information to help the state to move forward. And that's the kind of material that we provide, sort of as a template for others to write as well. Also, during the General Assembly session in spring, we helped to support what ended up being a defeat of allocating sales tax revenue, this general fund revenue of which we have so little compared to what we need, to having it being designated explicitly and exclusively for transportation. I'm from Northern Virginia. I know all about the transportation needs in our state, but I also know that a lot of capital projects would be better funded through capital than through general operating at the same time when unemployment and TANF and SNAP and all of these other core program demand is far exceeding the supply that we have in the state. So those are the kinds of things that Nonprofit Virginia can help your organization to understand, to decide if you'd like to participate in how we think through messaging, advocacy, organizing, reaching the media, actually scheduling visits with legislators, to be more effective with that part of your day that you can afford to spend thinking about these issues relative to delivering your mission. So that's what we do. And our goal is to work in partnership with Virginia Housing Coalition and all of you. And we also have membership information in your packet and more information about what Nonprofit Virginia has accomplished. I want to point out just a couple of people in our audience so that you know that there are additional resources here just beside myself. And our chair, Greg Peters, is here from UMFS. And Michael Farley, who's our membership co-chair, he's with Elk Hill. And then in the back is our policy and committee chair, Carrie Wilson from Reston Interfaith. And all three of them help our members to weigh in and decide what our priorities should be, so we can get the data information that we need from the Commonwealth Institute and others, and help pump that information out along with schedules so that you can take advantage. So I just wanted to acknowledge the three of you as additional resources, and obviously you think Nonprofit Virginia is enough of a priority for you to take on these Grand Poobah titles. So I hope that we're doing good work for you.
I should just say real clearly, we're glad to be here with you today. As a CEO of UMFS, one of the reasons I got involved in Nonprofit Virginia is for years we've been a service provider, working with children, working with adults, doing housing, doing education. But what we saw is that we really need to move into being advocates first and transforming communities. And I think we have all that in common, but we can't do that unless we do it together. So our thought is if we spread across a wide sector, we could really support each other in some of these tough issues that we know our families and children are facing. So the exciting thing is we're going to see these meetings bubbling up all over Virginia. Michael's going to be going. We already have membership all over Virginia. We hope if you're interested, we can share more with you. Michael, who's here as our membership co-chair, would be glad to talk to you about it. But we just think we're in a real exciting phase right now.
So I think that's
I wanted to thank Bon Secours Richmond Health System that provided some support for us to have the meeting today. Very, very generous of them to do that. And of course, I want to thank VHDA that makes this fabulous meeting space available to nonprofits at no cost, on a year-round basis. So thank you all for coming. Really appreciate it. This was a fabulous session. Michael, thank you so much. There's great resources at their website. I think we have some of those studies posted at the Housing Coalition website as well. So thank you, and we'll continue to build on some of the energy that we got going this morning.
And if by any chance you were someone who had not RSVP'd before coming today, if you could just see me, then we make sure we get you on mailing list for some